So maybe we could just, you know, start with you, Susan. You know, it's really interesting. Last year we focused on this new understanding from the OBGYN Society and the Endocrine Society for the first time coming out saying that there might be a problem with the number of chemicals and they were being passed transgenerationally. We've heard that it takes 17 years for new science to make it into practice. Do you see that what you just shared is an example of that, of it's just no one's really still taking into account the toxic elements of some of the things they're spraying there?
Well, I would just say that we want to protect people, and it's with good intention, but because we have, just like with pharmaceuticals, we depend on chemicals for the answer, and what these chemicals are doing are really, they're endocrine disruptors, they're hormonal disruptors, they're neurotoxic, they're carcinogenic, and we have to think about it. And as functional medicine practitioners, what I would think is we also have to think about how do we help people to neutralize, detoxify, and if we are exposed, how do we then work to heal ourselves? And the last thing I just wanted to say that I didn't is that, I think I missed that slide, is that these are also neonicotinoids, which are, they kill the bees, basically, and the butterflies. They're anti-pollinators. And so we have another problem, which is that we're really, just ecologically speaking, we're creating another imbalance. And these pesticides, just like antibiotics in our microbiome, these pesticides are allowing the Zika virus to become resistant as time goes on. So what do we do after that when you don't have any more chemicals or antibiotics? I think we're looking at a very big issue that we don't know the answers, but we have to ask the questions.
Greg, a lot of these costs would qualify as negative externalities, you know, in economics. How do we go about measuring these and putting them into the numbers, because they're so hard to quantify?
Well, I think the key is to try to frame the decisions right for decision makers. I think lots of times people get a lot of pressure to make the right decisions here and are not in a comfortable position. And I think that we can, as a community, sometimes, I think it's about not only giving the information, but it's actually putting it together in a story that they can understand, so that it can become a lot clearer. Because in my experience, oftentimes the policymakers don't really get the full picture, and it's sort of compressed to a couple of action points. How can we take action quickly and just get
and to
manage the front page story.
Yeah, absolutely. Dr. T, you're working in seeing patients all over the world, but a lot of people here in Florida as well. Are there certain things that you see in Florida patients, maybe not related to Zika, but maybe related to the sun or otherwise, that you think are unique to the population in Florida?
Of course, but I would be first inclined to tell people that the sun is our friend, for the most part, and we have a tendency to blame everything on the sun, everything under the sun. And, when dealing with the skin, it's always important to focus, first of all, on melanomas, because melanomas are killers, and I want to empower practitioners not to assume that just because somebody has a skin condition that appears dangerous, that they have to immediately think of the specialist that is dealing specifically only with skin. And the reason is, from our experience, is that when we send a patient to a practitioner that is a specialist, sometimes the treatment will be a lot more aggressive, invasive than is necessary, with outcomes that are not necessarily the best. We'll take into account the issue of melanoma. Recently, there was a study in the Journal of Dermatology that shows specifically that the parts of the skin that are most likely to develop into melanoma are not what we normally thought they were. A tiny dot, a tiny dark spot on your body, usually where the sun does not shine, usually where there was no significant sun exposure, is the one that is the most aggressive, the most invasive, has the deepest roots, and is most likely to become metastasized because it will reach the circulation much faster than the larger lesions that most practitioners are looking for. And in medical school, we learn about the A, B, C, D, E, right? Asymmetry, border, color, etc., diameter. And we assume that the larger lesions are the ones that are the highest risk. And the skin doctors are still doing that, are looking for the large lesions. When the study has shown conclusively that the tiniest lesion that appear out of nowhere, that you don't remember where they came from and when they started occurring, those tiny dark specks are the ones that are the fastest growing inwards and that are causing melanoma. Now, I don't have statistics about Florida being a greater state for melanoma than other states. Obviously, we will have more carcinoma, which is not so lethal, the basal cell, squamous cell carcinomas, which is a different issue, which I'd like to address some other time. But if you take something out of it clinically, I would like you to look at your patients and see if they have a dark, tiny spot that appeared out of nowhere, that is usually where the sun does not shine. And that's the one that should be eliminated. And if a person has 30 of them, we all know from 20 years ago that the #1 risk factor for melanoma is multiple pigmented nevi. How do you eliminate multiple pigmented nevi? You cannot remove 100 by doing 100 surgeries. You need to use some type of a non-invasive method, a non-aggressive or surgical method, to simply dry out those tiny lesions, eliminate them. It's fairly easy to do with certain acids, certain liquids, and then they slough off, and if there is no root, if there is no pigment remaining, there will never be a melanoma in that patient or in 1,000 patients that will undergo the same treatment. It's very simple, but it is not something that you are likely to hear from the typical specialist in the skin, who are still looking for the large lesions and are looking only for the one that they can do surgery on. Whereas the small, tiny ones, they still are ignoring because they don't know what to do with them. So it's maybe something that the functional approach, the preventative approach, should be looking at a little more closely.
Awesome. JJ, before I ever met you, a long time ago, I read an article. It was called The 8 Reasons Why You Can't Lose Weight, or something like that, 6 or 8. And I think one of them was toxicity in the environment. What chance for people to lose weight when they're literally spraying it from the air?
I know. I've been fascinated with weight loss resistance for 30 years, and I stumbled upon, like, I was teaching this course for doctors, and I stumbled upon this information. I'm trying to remember who the researcher was on toxicity. And this is such a key problem. If you have this, it doesn't matter. And that's what I saw with diet is you could be eating perfectly, exercising, but if you have a toxicity issue, now you've got endocrine disruption, your metabolism is lowered, you're going to hold on to body fat, because the last thing your body wants to do when you've got all this toxicity stored in your body fat is to release toxins. And it also makes you think a step deeper in that whenever you're doing a weight loss program, you're doing a detoxification program, and you have to be very careful when you do that, because if you're losing body fat, you're freeing up toxins. So you have to make sure that you're supporting detox pathways as you're helping someone lose weight.
That's awesome. Yeah. I'm not going to ask each of you who you're going to vote for. A bit controversial and going there. But I would ask you, just from your own unique perspectives that you've shared today, what you feel, and maybe I can start with you, Dr. T, and we can make our way down. What is the one thing that you think that the functional and integrated medicine community needs to do to take its rightful place at the forefront of medicine?
I would say 2 things. First, we need to embrace science in unequivocal terms, because the medical profession, traditionally the allopathic profession, has tried to continue tradition, and they call themselves traditionalists for specific reason. They like tradition. Allopathic medicine is mostly tradition-based, and if we embrace science, we can claim it as our own. Functional medicine, natural medicine, preventive medicine, nutritional, holistic, that is science. Whoever is ignoring holistic principles is not going to be scientific, because science shows us the interconnectivity between body organs, systems, microbes, and so on. So you have to be holistic to be scientific, by definition. And if we embrace that and run with it, then science will be with us, and the allopathic profession will gradually have to move forward to be with us in order to stay with science. That's one thing. And the second thing is to look at children. Every adult that has a chronic disease started somewhere in the past as a child that was not appropriately taken care of by society. That child was getting treatment at a pediatrician's office, and the outcomes are not observed by the pediatrician, but by whom? But the doctor who sees that child as an adult later on with chronic illnesses. If we understand what makes children sick in our society, and our society has the sickest children of all societies on earth. If 1 out of 3 to 1 out of 5 children are on medical drugs, and so many children are diagnosed with all those diseases, from attention deficit to autoimmune disease, allergies, asthma, autism, and cancer now is becoming a big thing with children, there must be reasons that we have to investigate. And nobody is asking those questions, and then we get surprised when society is overburdened economically with all those sick adults that we cannot handle because they don't they don't take their share of the burden of society. They don't contribute as much because they're sick adults. And we have to ask those questions. Now, I'm fortunate that I have 20,000 children in Nepal in my organization. The orphanages and schools and child learning programs and mothers groups. We have 20,000 children in a network all over rural Nepal. And yes, they have problem with malnutrition because they don't have access. And yes, they can be injured and die because they have no immediate health care available to take care of the children's injury. But one thing I've noticed, and we've started doing some research and collecting data, in 20,000 children, not even one child is autistic. Not even one child has asthma and allergies. Not even one child has learning disorders. They don't know what those things are. They've never seen them in rural areas. And they are the control groups, if you will. Because there are no children in the West who are not exposed to the multitude of exposures that could be the root causes of all this sickness and illness that we see today. And to me, investigating those causes so that we can keep our children healthy, so that they will become healthy adults without chronic diseases, that will be a huge advancement forward for functional medicine.
Absolutely. Yeah, here. So, Susan, same question for you for that. What do you think is the number one thing that our community as practitioners needs to do to take its rightful place in the future of medicine?
Well, I think that the whole field of functional medicine dovetails with lifestyle approaches to health and well-being. And so we have to look at everything that's creating the chronic diseases that we have today. And a big piece, and I think we've touched on it, and is the environmental component, that probably 90% of all cancers are triggered by environmental causes. And so if we start to address, and I think for practitioners, besides practicing, we also need to get involved, and we need to advocate for healthier environments and organize in our communities and be part of the solution. I think that we really hold an important place in being able to do that. And I'll just say, as a nurse, you know, with 17 million nurses in the world globally and 3.4 million in this country, in communities everywhere, that if one professional segment really was able to have an impact, that would be a good place to begin.
Beautifully said. Let's get every nurse watching the Functional Forum. That's a good start. We'll talk about how to do that. Craig, I'd love to get your thoughts on that.
I think it's about actively seeking partnerships and collaborations with other stakeholders, even ones that might not come to mind in the beginning. I think, for example, sometimes the insurance companies are thought of as the enemy. But their, employers are interested, governments are interested. I think communities are interested in a different approach. And so, and I think it's a lot easier than ever to collaborate actively with different partners. We can't go it alone. And I think that to really get the change that we want to happen, we have to look within ourselves, but then out to other partners and figure out practical ways to just start.
Absolutely. JJ, final thought from you?
I'm going to throw it out to marketing. So here's the world as I see it. We all get together, we collaborate. Even if we don't have the same opinions, we don't put each other down out there to the world. We get together, we put our ideas out there. Social media and internet is the great equalizer. We all put our ideas out there, and we all share each other's ideas and tag each other, and we can take over that way. So through collaboration, sharing of ideas, and marketing, we've got this one.
Absolutely. Look, this has been an amazing panel. Thank you so much for sticking with it. I know that it's been a long evening. Thank you so much to all the Functional Forum meetup groups. Go to meetup.functionalforum.com.